Okay, for this skill of the BVM ventilation of an apneic adult patient, as always, we're going to do BSI scene safe. So we have our gloves on and the scene does look safe. We're going to now check responsiveness of the patient. Sir, are you awake? No response. We're going to check for breathing and pulse simultaneously. So we're going to take the carotid pulse. We're going to look at the chest rise and fall, listen for breath sounds, and then feel if we hear the breath on us. Both of which are negative, so we're going to go ahead and request additional EMS assistance. Once we've requested that, we're going to notice that the patient is unresponsive, apneic, and has a weak pulse. With that weak pulse, we're immediately going to make sure that the airway is opened. If we do suspect any sort of spinal trauma, we're going to do the jaw thrust. If no spinal trauma is indicated, we're going to just do the head tilt chin lift like this to make sure the airway is open. Once we open the airway, we're going to see that the mouth is full of secretions and vomit. So once that is, we're going to take our suction. Depending on your style of suction, you do need to cover it here to create that suction. When you go into suction, we are going to go into the airway and then create the suction, suctioning in a circular motion in and out, left and right for no more than 10 seconds at a time. Once we clear the airway of secretions, we're going to look again and make sure that there is nothing in the airway. Once we see nothing in the airway, after it's been suctioned, it's all clear, we're going to insert an oropharyngeal airway. This was measured from patient's ear to the corner of their mouth, so this should fit in. We're going to go in sideways to avoid the tongue, we're going to go in and rotate it as we go down. We're going to make sure that the patient has no gag reflex. If they do, we're going to pull this out and do a nasal pharyngeal airway, but the patient does accept the OPA. Once the patient accepts the OPA, we're going to immediately start ventilating the patient with the BVM. So this is the bag valve mask. We're going to do our CE grip. So we're going to put the mask on, CE, and immediately start ventilating. We're going to ventilate at a rate of 2 for every 30 compressions if we're doing compressions. And we're going to check the pulse after 10 seconds. Pulse it should return. If pulse does not return, we're going to continue bagging the patient. But at this point, we're going to connect it to oxygen. So we're going to connect this to our bag here at the stem. And we're going to connect here to our regulator that's going to be on our oxygen tank here. We're going to open this and turn it to 15 liters. And now we're going to be doing oxygen-assisted ventilations. We're going to make sure that these are appropriate ventilations by seeing chest rise and fall. And then we need to make sure it's a proper rate. So that's 1 ventilation every 5 to 6 seconds. We know that we're doing a proper one, chest rise and fall, and ideally the vital signs start to come back up. We're going to continue to do this until ALS or more units arrive on scene.